Topic: Understanding ECG interpretation, insights into cardiac conditions and electrocardiogram changes. About electrical impulses and how they work in the heart's electrical system controls the timing and sequence of heartbeats. This system consists of specialized cells that generate and conduct electrical signals throughout the heart muscle. Here's a simplified explanation. 1. Sinoatrial, SA, node. The SA node, located in the right atrium, is the heart's natural pacemaker. It generates electrical impulses that initiate each heartbeat. 2. Atrioventricular, AV, node. The electrical impulses generated by the SA node travel through the atria, causing them to contract and pump blood into the ventricles. The impulses then reach the AV node, which serves as a relay station, delaying the impulses slightly to allow the atria to finish contracting before the ventricles receive the signal. 3. Bundle of His and Purkinje fibers. After passing through the AV node, the electrical impulses travel down the bundle of His and then branch into the Purkinje fibers, which distribute the impulses throughout the ventricles, causing them to contract and pump blood out of the heart. This coordinated sequence of electrical impulses ensures that the heart beats effectively and efficiently, pumping blood throughout the body. Dysfunction in any part of the heart's electrical system can lead to arrhythmias or other cardiac problems. Interpreting an electrocardiogram, ECG, involves analyzing the electrical activity of the heart to assess its function. Here's a brief overview of how to interpret an ECG. Understand the basics. An ECG provides information about the heart's rhythm, rate, and electrical conduction. It records the electrical impulses generated by the heart as it beats. Components of an ECG. An ECG consists of several waves and intervals. P wave represents atrial depolarization, contraction. QRS complex represents ventricular depolarization, contraction. T wave represents ventricular repolarization, relaxation. Analyze the rhythm. Determine if the rhythm is regular or irregular by measuring the distance between R waves, RR interval. Regular rhythms have consistent intervals between beats, while irregular rhythms vary. Calculate the heart rate. The heart rate can be determined by measuring the number of QRS complexes in a specific time frame, e.g., 6 seconds, and multiplying by 10. Assess wave morphology. Evaluate the shape and duration of each wave and interval. Abnormalities in these aspects may indicate heart conditions such as arrhythmias, ischemia, or electrolyte imbalances. Check for intervals. Assess the PR interval, from the beginning of the P wave to the beginning of the QRS complex, and the QT interval, from the beginning of the QRS complex to the end of the T wave. Prolonged or shortened intervals can indicate certain cardiac conditions. Look for ST segment changes. Changes in the ST segment can indicate myocardial ischemia or injury. Examples of diseases or conditions and the changes they can cause in an electrocardiogram, ECG, myocardial infarction, heart attack, ECG changes, ST segment elevation or depression, T wave inversion, Q wave formation, indicating necrosis, and sometimes arrhythmias like ventricular fibrillation. Explanation. A heart attack occurs when blood flow to a part of the heart muscle is blocked. The affected area shows characteristic ECG changes due to ischemia or injury. Atrial fibrillation, AFib, ECG changes, absence of P waves, irregularly irregular RR intervals, and fibrillatory waves, F waves. Explanation. Atrial fibrillation is an irregular heart rhythm originating from disorganized electrical activity in the atria. It is characterized by rapid, irregular electrical impulses and ineffective atrial contraction. Atrial flutter, ECG changes, sawtooth-shaped flutter waves, F waves, typically seen in leads 2, 3, and AVF, with a sawtooth appearance. Explanation. Atrial flutter is characterized by rapid atrial depolarizations typically at rates around 250 to 350 beats per minute, leading to a regular and fast ventricular response. Bundle branch block, BBB, ECG changes, widened QRS complex, greater than 0.12 seconds, altered QRS morphology, depending on the specific branch block, and sometimes STT changes. Explanation. Bundle branch block occurs when there is a delay or blockage of electrical impulses along the bundle branches in the ventricles. This results in altered depolarization patterns reflected in the ECG. Long QT syndrome, ECG changes, prolongation of the QT interval, greater than 0.44 seconds, T wave abnormalities, often with prominent U waves, and torsades the points, a specific type of ventricular tachycardia. Explanation. Long QT syndrome is a disorder of the heart's electrical activity, characterized by a prolonged QT interval on the ECG. It can predispose individuals to potentially life-threatening arrhythmias.